Hello everyone, I'm Dr. Santoshi Nandigam, Consultant Obstetrician and Gynecologist in Cadence Hospitals, Kodambakkam, Chennai. Welcome to my YouTube channel. In this video, I'm going to talk about how to eat right in pregnancy. Pregnancy la correcta eppadi saapidnu. We are all accustomed to our mothers or mother-in-laws feeding us a lot of food, telling us, no, you're pregnant. நீ வந்து 2 பேருக்கு சாப்பாடு சாப்பிடணும். You have to eat for 2. You should gain a lot of weight. You should gain a weight which is more than your husband. So on and so forth. Being pregnant doesn't mean you should actually eat for 2 people. It only means that you should be able to eat enough for you, which is both balanced and nutritious. So we all know our food has certain macronutrients and micronutrients. So the carbohydrates, proteins and fats, these are all called as a macronutrients because we derive most of our energy from these macronutrients. So apart from the macronutrients, we also have something called as the micronutrients. We have minerals, we have vitamins, vitamin A, B, C, D, E, we have iron, calcium, sodium, potassium, zinc, selenium, manganese. These are all micronutrients and they are called so because we don't need them in large quantities for our day-to-day activities. We don't really derive our energy out of those micronutrients, but we definitely need them for our integral processes and metabolic processes that happen inside our body. So in a non-pregnant state, for an average weight woman, she requires about 2000 kilocalories of energy per day. A pregnant mother will only need a couple of extra calories more. Let's divide the pregnancy into trimesters. The first trimester, second trimester, and the third trimester. Would you believe if I actually told you that in the first trimester, in the first 3 months of pregnancy, you do not need any extra calorie? Most of you will not believe me. Probably the mothers or mother-in-laws listening to the video will not even listen to my next videos. But honestly, as per any international guidelines related to pregnancy and delivery, the first 3 months of pregnancy, if you're eating exactly what you were eating before, provided it's well balanced and healthy, it's fine. You don't need any extra calories in the first 3 months. In fact, it is actually very difficult to keep up with the 2000 kilocalorie count because of the nausea and vomiting, because of the reduced appetite and all. The second trimester, you only need an additional 350 kilocalories per day, which is required to meet up with your pregnancy requirements. So, ரொம்ப நம்பர்ஸ்ல எல்லாம் பேசினா ஒன்றும் புரியாது. So 350 kilocalories per day ஆனா என்னன்னா maximum a big glass of skim milk and a bowl of oatmeal. That's all is what you need. The final trimester or the third trimester, you will have to add up another 100 kilocalories extra, which is 450 kilocalories per day. In addition to the 2000 kilocalories of your routine. So this is the calories that you require in the different trimesters of pregnancy. But do you have to really keep counting the calories? I say don't count your calories, count your protein. In a day, you should be able to derive your energy 40% from the carbohydrates, 30% from the fats, and 30% from the protein. Always count the amount of protein that you're consuming. Can you imagine how much of protein that we usually take in a day? Can you take a guess? Okay, let me just wait for it. But do you know how much of protein we are supposed to take in a day? A non-pregnant woman will have to take approximately close to the body weight of protein per day. So if someone's weighing 75 kg, they're supposed to take 75 grams of protein. In a pregnant woman, it's about 1.5 grams per kg weight of the protein that is supposed to be taken. So you'll have to take somewhere close to 90 to 100 grams of protein. So there is only one thing that you need to count in your food, that is the protein intake, because protein is the most important thing that is essential for a pregnant mother. Then comes the fats and then comes the carbohydrates. So coming back to the topic here, how to eat right in your pregnancy. Here is my rule of 3s to eat right in pregnancy. 3 meals in a day: breakfast, lunch, and dinner. 3 snacks in a day, and it should include 3 different portions of fruits. So the carbohydrates that you eat come from the rice, the whole grains, the oatmeal, the fruits. So 3 meals, 3 snacks in a day, including 3 portions of fruits, 3 different kinds of dry fruits: walnuts, pecans, almonds, pistas, and 3 different types of seeds: sunflower seeds, flax seeds, watermelon seeds, 3 teaspoons of seeds in a day. 3 liters of water in a day. So this is my rule of threes. If you are able to stick to it, let's say if you're able to meet up with the 75% of this rule of three, I think you're good. You're eating right in your pregnancy. So when you plate your meal for lunch, you should be able to have or incorporate all these things. You should be able to incorporate a portion of carbohydrates. You should be able to incorporate a portion of protein in the form of lean meat, or if you're a vegetarian, it can be in the form of paripu, lentils, beans, chickpeas, soya, tofu. You should be able to include good fats in it, and including yogurt, which is also a pre-probiotic. And you should be able to supplement with a little bit of fiber. Fiber is most forgotten, and it is a quintessential nutrient for us to deal with constipation in pregnancy. Fiber also helps in balancing your blood sugars, and that's about it. That's how you have to eat right in pregnancy. Thank you.